This is the old medication trolley that we have. And this is a similar trolley that we are using in the hospital. So when you go to your station next week or after a week, each one of you will be given a trolley with complete medications inside. And before you start the procedure, I want you to orient your students with the different parts of the medication trolley. What do they expect inside? Okay. Ideally, all medication trolley has a lock. Even in the hospital, I think it is secured. It has a lock. Okay? And this is very important to tell your student. There is a system of organizing the medication inside the trolley. Most wards are using the alphabetical system of the medication. They just arrange the medication in alphabetical order. I think there are also some other units there wherein they arrange the medications by system.
Yes.
By system itself.
Yeah,
cardio, digestive, etc.
Antibiotics on one side.
Yes. It is classified according to group.
They are also classified according to the alphabet.
But emphasize to your student that it depends on the institution, and they have to be oriented with that. But for the purpose of our learning here in the lab, when they use this trolley, the medications are alphabetically arranged. However, if they are fortunate to use the old one, this is the old one. I don't know if they're still using it. Medications are just there without any arrangement. You just need to arrange it well, but there's no system anymore. Anyway, you will see it later on that the medication are there. But I prefer this one. Okay. Aside from this, these are the other important parts. Yeah, this is for the disposal of, and for the cups. And orient them that there are other miscellaneous things that they can see here, like this one, medication cutter. I'm going to show you later on. And also for to powderize or to crush the medication. I do not know if they have this one in the hospital, but here we have. They have mortar. Okay, normally our medication trolley should have a drug reference handbook. Even in the hospital, they have. They would also expect some syringes on this side of different sizes. This is very important, especially if they start, learning the injection. So the different syringes are here. It should be arranged well. This one can be used also in preparing, if you have a lot of medications to be prepared. You can use that one. Here, the old one, I think is this one. And the syringes are here. See, it's very traditional, but I like this one. This one. This one, you can just put it like that, and you can actually.
Yeah, and the prescriptions on top there.
Yeah.
Yes.
Okay. And other things, ma'am, like needles, cottons, etc. Just get yourself familiar with these things. Oh.
I don't know Royal, but Masera have different systems as well.
Okay, we shall start the procedure. I'm going to show you how to do the medication administration. The first step in medication administration is, of course, checking the MAR. You never go directly to your patient and give the medication without. This is the first step. When you go to the hospital, when you work as a nurse, the first step before you go to the patient is to check what are the possible medications that you have. So the first step is MAR. Normally the MAR is in the system like this. And you need to tell your students that each nurses have their own passwords and they can only access their own account on the MAR. And they should never let other nurses use the password because it should be for them only. Okay. I want you to present the scenario to the student as if they are doing the medication itself. When they open the system, and then when they click the patient's name, and then they click the medication itself, it will show them the list of all medications. Like that. Okay? And then by looking at the medication itself, they will know which medication is to be given on your duty. Like what medications to be given at 8 o'clock. You need to check. So what medication I'm going to give at 8 o'clock. I have here once a day, etc. etc. Okay. Now after identifying which medication is to be given to the patient, the next thing is to go to the patient and do the initial assessment. For example, there's an order of Panadol at 8 o'clock. So there is Panadol. I have checked already the MAR. There is Panadol to be given at 8 o'clock in the morning. So now I'm going to go to the patient and do my initial assessment. As a nurse, you know already the purpose of Panadol. Because the patient had surgery. It is used for pain, as a pain reliever. So before you go to the patient, you need to bring something for your assessment. Remember in our assessment earlier, specific assessment related to the medication. So since Panadol is for pain and the patient had surgery, I'm going to bring with me pain scale. And of course, I need to bring okay. So I have checked already the system. There's Panadol. I'm going to prepare myself. I have hand rub with me and I have a pain scale with me as well. Okay? You go to the bedside, provide privacy. Okay? And then the usual thing that they do. Good morning, sir. I'm Sir Leola Braga. I'm the nurse for today. And I checked your MBR and there is a medication to be given this morning. But before that, hand rub. While they are doing the hand rub, teach your student to communicate at the same time so that they will be saving their time.
Yeah.
Sir, can you tell me your full name? Muhammad Ali, okay. Okay, can I check your ID band?
Yes.
Okay. ID band is Muhammad Ali, and then I will going to verify Muhammad Ali, MRN 12345, so this is 12345, so this is my right patient. Okay, sir, there is an order for medication for you today, and it seems that you had a surgery 2 days ago. Do you have any allergies to medication? See, I'm now assessing the patient. The one that, those lists that I have shown to you earlier. Do you have any allergies to medication, sir? No. Okay. Have you taken your meal already, sir?
Yes.
Because I'm going to assess for swallowing. Did you have any episodes of nausea and vomiting?
No.
Okay. Try to check if there's MGT in your patient. And try to check the chart if the patient is on MPO. Okay? And the most important assessment is pain scale. Okay, and you had the surgery 3 days ago, and do you have a pain, sir?
Yes.
And then ask your student to do the PQRST. You know already the PQRST in vital signs. I think the other side. P, do you know already?
Yes, yes.
Okay? Part of pain assessment is PQRST. And once the patient already answered the PQRST, you are done with your assessment. Okay, sir, it seems that you have severe pain and there's an order of pain medication. Just give me a few minutes. I'm going to prepare the medication and I will be back. Is it okay, sir?
Yes.
And then you go out and prepare the medication and the medication trolley. Ideally, preparation of the medication is within the medication trolley. In the hospital, this is mobile. They can actually push this one on the bay. For example, the bay is there. They just actually push this one and go near to the patient's area.
Yeah.
But I think in some hospitals, they have a medication room where they prepare the medication itself. But in advance, I think they have to bring this one to the bedside.
Adult in the area they have this trolley.
There is separate room.
Yeah. But in advance, I think we need to push this one to the area.
And also they have the computer.
Usually in each medication trolley, there is one computer on the top where they can access the MER of the patient. So this is my computer. Okay, to make it more realistic. Anyway, like this in the hospital. I don't know if you went to the hospital. It's like this. Okay. So I did my assessment already. At this time, I'm going to prepare the medication. This is very important. Before you start preparing the medication, you need to ask for a second nurse. Specifically a senior nurse in checking the medication. He will validate the medication preparation that you're doing. Okay, ma'am, I need a second nurse. Usually a senior nurse would come. This is a critical element in the exam. If they will not call for a second nurse, they will be unsafe. Students should call for the second nurse. It's not the teacher. Okay?
The nurse is the teacher.
Yeah, the second nurse is the teacher.
Yes.
Okay, this is very important. There are 3 checks that they should do. These are important. Okay, the first check starts after taking the medication from the shelf. Since the medication is Panadol, is it Panadol? Okay, so Panadol. So the first thing is they have to look for P because it's Panadol, letter P. And letter P is PQ here. Okay, now, after taking the medication from the shelf, the first check should occur. Okay, and the first check should be together with the second nurse. And how do we do the first check? We need to compare the information on the medication package with the information on the MAR, together with the second nurse. So the order is Panadol, 500 milligram oral 3 times a day, and I need to give 1000 milligram. So this is Panadol, 500 milligram. Okay, expiration date is January 2022. So first check is over. Now I'm going to prepare my other materials. I'm going to prepare my medication cup. Normally in the hospital, at the bedside, they have their own water. And make sure, since nursing is an art, teach your student to use a tray or kidney basin if there's no tray. Okay, after preparing these things, the next thing is to put the medication on the medication cup. But before they do that, they do the second check. Okay, again, ma'am? Yes. Second check that includes calculation. Ma'am, second check. Okay, the order is Panadol 500 milligram oral and 3 times a day. Quantity to be administered is 1000 milligram. This is Panadol tab 500 milligram. Expiration date January 2022. At this point, the student should calculate. The order is 1000 milligram. Available is 500. It is now where you can assert the formula to the student. Okay, available is 500, ma'am. Order is 1000. I'm going to give 2. Okay, and then now we can put the medication on the medication cup without touching the content of the medication, like this. So second check is over. There is a last check. Last check should occur before you place back or put back the medication on the shelf. So this is 2 tablets, ma'am. Okay, third check, ma'am. Panadol 500 milligram, 1000 milligram. This is Panadol 500 milligram. Expiration date is January 2002. I put 2 tablets. And then put back the medication back on the trolley and lock. So you're done preparation of the medication. And the role of the second nurse is over. Only for checking. This is very important. Okay. Normally in the hospital, they put sticker label on the medication cup. Like this. The sticker label that they have is like this. They usually put a sticker here. In some wards, you can see. Or sometimes they just write it with the use of pen. Okay? But some stickers they are using.
Because they have to prepare maybe for more than one patient.
Yes,
at the
yes.
same time.
Okay? Now that the medication is ready, normally you just need to push this one to the patient's bedside. Okay? Okay, but anyway, I'll just go in there. So go back to the patient's bedside. Again, privacy. Re-identify the patient. That is very important. Sir, I'm back. I have your medication already, and I think it's time for you to take your medication. Before the patient or before the student give the medication, the first thing that he should do is to reposition the patient. Sir, is it fine if I elevate your head part, or I can put you in semi-Fowler's position? Again, emphasize why is it important, because we want to prevent aspiration to the patient.
This is critical element, this step. Many will forget.
Which was
Many students forget this step, but
Okay.
it's critical element.
Fowler position.
Sitting, I shall get sit up.
Oh, by the way, in the assessment, I forgot, part of the assessment is to ask the patient if he is familiar with the medication.
Yeah. Knowledge.
It was in the PowerPoint, but I forgot to do it. Okay, now the patient is in the right position, and the nurse is ready to give the medication. Okay, just before you give the medication, you need to tell the patient what you are giving. Sir, I have here your Panadol, and this will help reduce your pain. The student should tell the purpose, the desired effect of the medication to the patient. Okay, this is very important. When giving the medication, let the patient decide how he's going to take the medication. Sir, do you want me to assist you in taking this medication, or you want to take this medication by yourself? Yeah, and emphasize to them that we are promoting autonomy to the patient. Okay. When you go back to the bedside, as I mentioned earlier, you need to reintroduce your patient and you need to re-identify the patient. Re-identify of the patient is very important, and it should be done every time the nurse go back to the patient. Even if you went there in the morning and then after 1 hour you go back again you need to do the patient re-identification. That's the common mistake of the students. Okay? So I identify the patient again, I ask for the name, and then I verify the ID band, I visualize, and I verify. Okay? So at this point, I'm going to give the medication to the patient, and he said he can take the medication by himself. So I just give him the cup. Or if the patient cannot do that, you can assist. Okay? And then the water. And the medication is there already. As easy as that.
Yeah, we have to beside the patient. Yeah.
Okay? This is important also to tell your students that if the patient is still eating when they go to the bedside, they cannot just leave the medication on the side.
Especially if they are sleeping.
Okay? Or they cannot just endorse this to the family members. Okay? They should be the one to administer it, and they should witness the patients taking the medication.
And make sure that the patient already took it.
Especially.
And in some instances, you can even ask your patient to open the mouth, especially psychiatric patient. Just need to emphasize that to your student.
Yeah, because sometimes they can get psychiatric in the medical
Yes.
ward, the hospital, yeah.
Okay. Now, after giving the medication, normally we ask our patient in this position for a few minutes to allow absorption of the medication before going back, placing back the patient in supine position. Okay, sir, I'm going to be back after a few minutes. Remember, you're going to do evaluation at the end. Okay, if you have any questions or any problems or any concerns, and you want the nurse, just press this one or press the call light, and I will be back. Okay, sir? And then you're done. And then you close the. Now, this is very important. We're not yet done. Of course, you need to put back all the materials that you have used, dispose whatever is disposable, and finally, the documentation. The documentation normally in the hospital, you just need to automatic. It's automatic, you just need to click. But in the lab, the student should put the initial, the sign. Okay? Also with the second nurse. The second nurse should also sign. That's why it has 1 and 2. But in the hospital, it's automatic. Here, ma'am.
Their ID, the second number.
Yeah. Here in the lab, we just ask for sign here. 1, the nurse who administered. 2, the witnessing nurse. And make sure your student has a pen, has a ball pen. Because students would ask the teacher for a ball pen. Now, after the documentation, okay. Okay, now, after doing the documentation, you need to go back to the patient's bedside again because you're going to do your evaluation. The same process. Okay. Provide privacy, the never-ending patient identification, and evaluation. Okay, sir, how are you?
I'm fine.
Alhamdulillah, that's fine. Sir, how is your pain?
Yeah, it has reduced.
Okay, sir, I have here the pain scale again from 0 to 10. 0 means no pain, 10 means severe pain. Can you point out where's your pain?
2.
Alhamdulillah. So you are now evaluating. Aside from evaluating the pain of your patient, try to evaluate also for any signs of possible side effects or adverse reaction. Do you have a, like for example, allergies or any untoward reactions that you can notice? But the most important evaluation is specific to the medication. Okay, sir. Is it fine if you if I put you back in supine position, or this position is okay?
Yeah, so fine.
Is this one okay? Normally, most students will get high mark in exam in oral medication,
Yeah.
in tablet and capsule. But if, okay, I'm just going to show you, because medication comes from different package. If the medications comes from this, it's easy to put the medication there. If the medication comes from a bottle, most students doesn't know how to open this. This is child-proof. They need to push it down before they can open. And you need to teach them. And when pouring the medication in the medication cup, they should not take it by their hand. They could either put it here or put it directly without touching it. Okay. If the medication comes from this package, commonly the medication, you just need to open the package and put like that without touching. Or if the medication comes from individual package, they can actually put the medication with the package here and open it at the bedside.
Yes,
I don't think we have
yes.
here.
Yeah,
Here, for example,
yes.
the patient has to take 2, just put it there and then open it at the bedside. Okay. Now, if the medication required is only half, you need to teach your student also how to divide this one, how to divide the medication. However, it is very important to emphasize that not all medications can be divided, especially capsule. Normally, we can only split the medication if there is a there's a line, there's a mark. That means we can divide this into 2. But some medication doesn't have that. And most importantly, capsule, we cannot split it into 2.
And some medication, the instruction is never crushed. Don't crush.
Yes, they have to read the instruction or the manufacturer's guidelines. Of course, without touching the medication, teach your student to put it in between. Or if they're afraid that they might touch it, they can use gloves. Okay? And they just need to press this one. Normally in the hospital, the other half, they just dispose it. But at home, you have to keep it because it's expensive.
Hospital also students dispose, staff use it again.
Yeah, hospital, they dispose it.
But ideally, let us teach what is ideal. They have to dispose.
This part. But at home, you can keep it because it's expensive. If the medication If the medication requires to be crushed, we use the silent knife because this is quiet, this is silent. Then the mortar that we are,
Yeah.
you know the mortar?
Yeah.
At home for pepper. In the hospital, they're using it, the one for pepper, and it's
Yeah.
noisy, but this one is silent. Okay? Normally, it comes with a transparent container. They put the medication inside, and then they just insert it there.
Yeah.
And then silent without noise.
أيوة.
And the medication is powdered.
Actually, it should be thick
أيوة،
papers.
في
We don't
specific
make
dyes.
Okay. I think this is the most challenging for the student. If the medication comes from syrup or suspension, because the preparation is quite tedious than the oral medication. If the order is this, of course you need to follow the 3 checks, but the preparation is very important. Before they open the medication bottle or the medication bottle, they have to check first the integrity of the bottle. They have to check for the cloudiness, leakage, any discoloration of the medication, or even the label, if they can still read the label. Okay? So I'm going to check the integrity of the bottle, so the medication is not cloudy. Okay? I can still see the label. There's no leakage, and the integrity of the package is okay. That is the initial step. And the next step is how to open this one. The same process. Okay? Now, when they open this medication bottle, they should put this one upside down, facing up. See, like that. It should not be like this, or else it will be contaminated. And the moment they close this one, kalas. So, like this, and like that. But, this is very important. Before they open this bottle, they have to shake it. Normally, the book says, roll it in the palm. They should never do this. At home, they're doing this. Usually, what we teach them is to roll it in their palm, because nursing is an art. At home, you're doing, or shwaya. Okay? Now, open, upside down, and this one. Now, in pouring the medication in the medication cup, they should do it within the eye level. They should never do this one. This is inaccurate. They should put it in a high table. They should put it here or here. Now, proper handling is very important. If the label of the medication is here, handling of the medication should be here. They should not. Okay. Now, when pouring the medication cup, handling of the medication bottle is very important. Okay? They should hold the medication. If the label is here, it should be towards the palm. So that the moment they pour the medication and the medication runs in this way, the label will not be erased. So the label should be here facing the palm. Okay? And with the eye level, teach them that this is calibrated. There's ml, there's cc, there's teaspoon, and etc. Yeah, my back will break. Like that. My God. That's fine. Okay? After that, before they put back the cup, they have to get a tissue or towel and wipe off the excess medication in the mouth. Because nursing is an art. And then third check, and then put back the medication. So the medication is here. However, if the medication, the order of the medication is less than 1 ml, you should use a medication syringe. Okay? Correct? 1 ml? 5 ml, sorry. If it's less than 5 ml, it's very small and it's very difficult to accurately measure the medication. But normally we use, especially Pedia, they're using this dispensing syringe. It's the same with the syringe that we are using.
But usually dispensing syringe will be in color, colorful syringes.
Yeah.
Pink, violet, purple color.
Okay, normally, if the order is less than 5 ml, we use this one. But we never take the medication directly using the syringe in the medication bottle itself. It's wrong. We never do this. This is wrong. Still, we pour it in the medication cup and we aspirate it from there. This is wrong. It will contaminate the entire bottle.
But it's sterile already.
But when you open this one, you might touch this one. That's why it will be safe. You just pour it here and then aspirate.
Approximate amount we pour it.
And for pediatric patient, we give this. Okay? And when we give this to the patient, normally we introduce the syringe on the side. And the side, not on the center of the mouth, on the side. So that the patient will not aspirate. You need to tell that to your student.
And what to do with the remaining? That's
Okay, by the way, important thing. Syrup, this is good for 1 month. However, if the medication comes from here, suspension, usually it is how many days? 1 week. And they have to learn that this is constituted with water, and they should read the instruction how many ml of water is mixed with this one. This is suspension. The other one is syrup. But in our practice, we just use the syrup. It's easy. But this one, they just need to add water.
In wards, they are having the susceptibility of medication. For every medication, there are sometimes for 1 week,
Yeah.
like 1 day, or even for 1 month, there is a susceptibility of medications or solutions whereby they'll give us a booklet, so they can refer the booklets.
Ointment.
Yes, for each one.
Poster
Okay. We go directly with eyes, ears, nose, and throat, and we will go directly